Good evening and welcome everyone to the Latinos Living Healthy Summer Webinar. Very excited you're able to join us this evening. My name is Daryl Modine. I am the LULAC National Vice President for the Midwest and have the great honor of being your host for this evening's webinar. So let me take a time out to say thank you for taking time out of your busy schedules to go ahead and join us this evening. So as most of you are aware, LULAC is our nation's oldest and largest Hispanic membership-based organization. We've been serving our country since 1929 in any manner of different ways. This evening, though, we are focusing on our Latinos Living Healthy initiative. It's a nationwide program by which we're really have built a number of components that we're implementing. The first is our Health Ambassadors program, where we're bringing local solutions to address national disparities, doing such things as educating local communities on what the Affordable Health Care Act means to them and how they can access services, to our Healthy Communities program, to our Super Madres campaign, where we're really taking a novel approach to combating the overuse of antibiotics in our livestock that are really taking its toll and making us literally more immune to the life-saving antibiotics that we need. To our healthcare webinars, such as tonight, as well as our Feria de Salud. And actually, our next Feria is coming up here on September 22nd in LA, Los Angeles, California, and we welcome everyone to come out and join us. We're going to be doing everything from free healthcare screenings, where we'll be doing blood pressure checks, cholesterol checks, and HIV screenings and more, all the way to really helping to educate and promote a healthy lifestyle, where we're going to be doing cooking demonstrations, really using heart healthy foods, to getting people going and moving to Zumba, and really encouraging a more athletic lifestyle as well. So we encourage everyone to come out and join us. If you want more information on this, by the way, please feel free to go to www.lulac.org, and we'll have a great deal of detail up there on the different programs we're going to have at that Feria. Of course, none of this would be possible without the strong partnership and sponsorship we have from our good friends at Walmart. This evening we have Javier Angulo joining us, who's the Director of Community Affairs for Walmart California. Then Javier, just let me say on behalf of LULAC how much we truly appreciate our partnership and your support of not just LULAC, but more importantly our community. It really has made a difference. And I know, Javier, you were telling me a little bit before about some changes that you've made. Do you mind sharing that with all of us?
And we've made progress. We minimized the number of tortillas and also the amount of lard we use in our beans. So I think that's really good progress. But again, thank you for inviting me to participate in the seminar. And you know, I'm really proud of the work that Walmart is doing in the space of hunger and healthier eating. Our commitment to healthier foods began when, as with everything in our company, it starts with our customers and our customers' request to get more healthy items. So we have increased the number of organics, for example, at many of our stores. We have, in January 2011, for example, alongside First Lady Michelle Obama, we made a commitment to make food healthier and healthier food more affordable, which is very, very key in this effort. We set out to do 5 things in the next 5 years. We wanted to make healthier choices more affordable. We wanted to develop strong criteria for simple front-of-the-package icon so that people know which items are healthier than others. We also wanted to provide solutions to address food deserts. So here in California, for example, most of our neighborhood markets, which is the new format, Walmart Neighborhood Market, have been open in food deserts. Many of these Latino underserved communities. So every time we open a store in one of these underserved communities, it makes me really happy that we are providing a service that currently doesn't exist in these communities. And of course, one of the last things that we're doing is we're increasing our charitable support for nutrition education programs. And of course, for us, it's very important to be in partnership with many of the Latino organizations out there, especially LULAC and their Latinos Living Healthy initiative, because that is the best way that we're going to get the information across. As all of us know, obesity and diabetes is such a big issue in our community, and that only through partnerships we're going to be able to combat that. And so, again, please count on us, on your partners. I know there's other people on this phone call, and feel free to reach out to our local Walmart representatives to find ways to feel or to seek solutions in fighting hunger and also combating obesity. So again, thanks so much for allowing us this opportunity, and we look forward to doing much more in the healthier food space.
Javier, thank you so much for that support. I want to thank you and the entire team at Walmart for everything you've done to really help illustrate this issue. You know, I don't think that there's any finer example than what we're doing this evening, where we show, you know, government working with the nonprofits, partnering with the corporations, really everybody working in concert to address something that is just critical to the future of our community and our nation. So thank you very much for all the good work that you continue to do. So our next speaker, very sharp-looking gentleman right here, Javier Morales, PhD with Latino Coalition for a Healthy California, is now here to talk to us a little bit about an initiative they have going. And Javier, thank you so much for joining us this evening as well.
Thank you also, and thank you to LULAC for the invitation to participate in this important webinar. And I got to commend you guys for the Latino Living Healthy initiative. You know, it's very timely and badly needed, especially as our numbers start to increase. You know, when we think about health, many times we are. I just tried to flip the slide.
Okay.
Okay, there we go. When we think about health, you know, we automatically think of emergency rooms or hospital care or acute care. But really, when you think about it, in the Latino community, can you switch the slide again, please? In the Latino community in California, the leading causes of death are heart disease, cancer, stroke, diabetes. You know, these account for over 54% of all deaths of Latinos in California. Next slide, please. And when you think about that, you know, when you think about the roots of each of these chronic diseases, you know, it is important to access health, and, you know, especially with the passage of the Affordable Care Act, covered California as our program here. You know, many people who haven't had access to health care are going to start having access to health care to help manage these diseases. But more importantly, what I think we need to think about is what's causing the diseases. And in the title of my talk, I called it a matter of justice, because when you start to think about the conditions that cause us to get sick, that cause heart disease, cancer, stroke, and diabetes, you know, what we're really talking about is the environment that we live in. Next slide, please.
Javier, will you mind going ahead and trying it again?
I'm pushing the down arrow and it's not working.
Okay, then I'll go ahead. There we go.
Okay, so here's I took a couple of quick screenshots of some maps of Los Angeles, and what I found is that these maps could actually be almost anywhere. These could be in Fresno, Tucson, Denver, you know, across the country, Washington, D.C. And basically in the middle right here, what you have in that dark hashed area where that number 46 is, and 47, that's mostly where the Latinos and the African Americans live, lower income. And so what this map shows is areas that are park poor. You know, if we want to be healthy, we want to be able to go out in the parks and exercise, and our kids need to, you know, be able to run around. But when your community doesn't have parks, it's really hard to do that. Next slide, please. And then, you know, another major issue is safety. You know, violence. And again, you know, this is a little bit different scale, but if you look at the areas that are dark red and that tannish color, that orange color, again, those are areas where primarily Latinos and African Americans live in lower income. And you know, you start to see that you know, when people live in dangerous communities, they're a lot less likely to go out and exercise as well. Also, economic development, you know, it's a little bit harder to open up a shop in areas where they feel that it's not safe and people aren't going to go and patronize the business. And I can also show these kinds of maps for a number of other criteria, including substandard housing, you know, education levels, dropouts, toxic waste sites, unhealthy air, the concentration of fast food outlets, and also what Javier earlier from Walmart was saying, you know, food deserts. So, you know, when we start thinking about the environments and things like diabetes and obesity, you know, people are making the best choices they can with what they have. And if the environments that they're living in don't have a lot of these amenities, you know, it's hard to have the same kind of life expectancy. Next slide, please. The California Endowment has a really awesome campaign going on in California right now called Health Happens Here. And what they've done is it's a campaign that shows that a life expectancy, it can be based on where one lives. And, for example, on the left here, I think that's in Stockton, life expectancy of 73, whereas on the right, you have a life expectancy of 88. I think that one is in Newport Beach area. Next slide, please. And we know that the difference between these two life expectancies, it's not a matter of genetics, it's not a matter of biology, but rather, next slide, please, but rather it's what's called, the determinants of health. Each of those things in the environment that helps us to make the right choices, to have the wherewithal to purchase the organic food, to have the education to know, what type of foods that we wanna eat that make us healthy, access to fresh fruits and vegetables, parks and open space, a lot of what I'm talking about right here. So, when we want to move upstream on chronic disease, we really need to be looking at these. Next slide, please. Because when we really think about it, our environment really shapes, our diet and activity patterns, whether we're using substances, tobacco, alcohol. And if you look at, again, some of the major causes of chronic disease, that are listed right here on the right, and you take it a step back, you see that it's, again, diet and activity, and a lot of these, again, are influenced by the environments that we live in. And so, next slide, what we're doing here at the Latino Coalition for Healthy California, established over 20 years ago, is to develop and support policies and direct services and socioeconomic conditions that improve the health of Latinos. Next slide, please. And we know that we can't do this alone. And I'm the new executive director here, and I'm very interested in helping to continue to promote healthcare access for all. But also, I'm interested in making sure that we keep the spotlight on those conditions that cause us to get sick in the first place. Next slide. Next slide, please. Because ultimately, what we know is that no one sector can actually solve the obesity or diabetes problem or any of the other chronic diseases, that it's really a compendium of different chronic conditions or elements that cause it. So it takes us all working together to be able to address these. And last slide, please. I want to thank, and this is kind of the environment. This is what we want to be able to see in our communities: people graduating, people active, safe housing, safe food, healthy children. One more slide, please. And this is my contact info. And again, very excited to be on this webinar with these other panelists. And thank you, LULAC, for allowing me to participate.
Oh, the pleasure is all ours. And Javier, thank you very much for that very compelling information. Boy, that one slide with life expectancy between zip codes, if that doesn't speak volumes, I don't know what does. So thank you once again. And anyone who's interested in learning more, please feel free to reach out to Javier here. If you have any questions or you're not able to jot this down right now, once again, give us a call at LULAC, 877-LULAC-01, and we'll be sure to forward that to you as well. Our next guest speaker is the Senior Vice President of Healthy California from the California Endowment. And Daniel, I hope I get this right. Daniel Zingali, did I get that right?
Perfect. You said that like an Italian. That was perfect.
Thank you very much.
It's an honor to be part of this conversation. Thanks for including us. I was invited to talk about access to health care, but I want to start by just saying I think Javier Morales got it exactly right by saying the most important thing to the health of Latinos and everyone in our state is actually what happens outside the doctor's office or the healthcare setting, those environmental factors that Javier was just talking about. That's most important and has the largest impact on the health of our people and ourselves and our families. But maybe the second most important thing is that people do need access to health care, especially preventive health care, has a great deal of value before conditions worsen or become things that require involved, expensive, and sometimes painful treatments. So that's what I was going to talk about, and the historic opportunity that Obamacare offers to California in finally expanding access to care, especially preventive care, to millions of people who have been outside the family of the insured. We get a lot of questions at the endowment about why our campaign to do outreach and enrollment in Obamacare is primarily focused on Latinos. And the reason for that is simple. If Obamacare is going to succeed in California, it has to succeed among Latinos, and the government's going to need help if they're going to succeed, because the track record here in California for enrolling people in government programs is not good. whether it's food stamps or Medi-Cal or the Earned Income Tax Credit. We've essentially failed time and time again, left billions of dollars on the table in Washington, D.C. that are really owed to Californians and owed to the health and well-being of our state. And we're determined not to let that happen with Obamacare. And that'll mean enrolling literally millions of Latinos in Obamacare within the next year or so. So we launched a campaign almost 2 years ago, which is now referred to as Asegúrate, and it's a partnership with Spanish language media and other outlets to try to raise awareness of the benefits of the new act and help people understand across cultural barriers, across linguistic barriers, how to enroll. Most of the people who are eligible for the Medi-Cal expansion in California are Latinos. Many of those people have English as a second language. So this focus on Latinos we think makes a lot of sense, and we're actually encouraging the government to recognize that to approach an issue like this in California and just say, we have a plan, and then we have a plan B, which is really important around Latinos, actually doesn't get it right. It has to start with Latino outreach and then recognize all the other important demographics that we have to reach out to: African Americans, Asian Pacific Islanders, LGBTQ, and Anglos who are eligible too. But the plan really does have to start with Latinos if we're going to succeed, and that's what our Asegúrate campaign is about. The only other thing I wanted to mention in addition to that campaign, which I hope you guys will all check out, is that there is one thing we don't like about Obamacare, and that is the unfinished business of Californians who are excluded from the new law because of their immigration status. As a healthcare foundation, we recognize that the health and future of the state depends on everyone who's here in California, including over 1 million undocumented Californians who aren't eligible for Obamacare. So we have a related campaign, a media advocacy campaign, and grassroots organizing around raising awareness among Californians and policymakers of the real benefits to our society of recent immigrants, regardless of their immigration status, whether they have legal status now or they aspire to. The fact is that those immigrants are contributing more to the society than they're taking. They're contributing more to our health and well-being now, and if we'll just find a way to make access, especially to preventive care, available to everyone, we'll all be a healthier and more prosperous state. Thanks very much.
Daniel, I'm sorry, I could have gone ahead and advanced these slides for you. Is there anything else you wanted to add?
No, that's it. Thanks very much again for including us.
No, Daniel, the pleasure was all ours. I should say the honor is all ours. Thank you so much for sharing that information with us. Our next speaker, Araceli Navarro, is the Advocacy Coordinator for the Community Clinics and Health Center and the ACA, Education and Resources Department. So, Araceli, how are you doing this evening?
Great. Thank you so much for having me participate in this great series. I think it's a great opportunity to get out to the community and let them know about some of the work that's happening and that we're working with our community clinics and health centers on to get the word out about the ACA.
Well, we're excited to have you, and forgive me, I should have said you're actually with the California Primary Care Association, and this is one of your initiatives here. So thank you once again for joining us.
Sure, no problem. So let me make sure, okay, it's not allowing me to also
there you go.
Shift.
Yep.
Okay, perfect. So just really briefly, I wanted to give an overview about the 4 areas I was going to touch on. The California Primary Care Association, who we are, our Healthcare Ambassador Program, similar but different to LULAC. We are technically in a fancy way called the Healthcare Ambassador Program, but it's truly our advocates, our grassroots campaign. And then CPCA on a larger scale has a campaign called the California Health Plus. And then I just wanted to quickly touch on some of the resources and actually advocacy partners which have been mentioned by some of the previous speakers. So I just wanted to let you all know CPCA represents more than 900 not-for-profit community clinics and health centers in California. We range all the way up to the Oregon border down to the San Diego border. It does vary in terms of how many there are across certain regions, but nonetheless, we are across the state of California. Our mission, I think, one of the greatest things is that we have an open door policy and we serve everybody regardless of immigration status or ability to pay. So I think that makes us unique in the community, and specifically, as has been mentioned, you know, we serve more than 5 million Californians a year, and more particular, serve 50% Latinos. So, when the Obamacare passed in 2010, CPCA took it upon us to start a campaign on educating our health centers. We have a large group of staff, and it was a great opportunity to educate them and then get out the information. It was a train-the-train concept. We were able to get out there and start informing people about what the Affordable Care Act meant to them, and especially in our community. Unfortunately, there's still a little bit of confusion about what the ACA is and how it's being implemented, and of course there's so many components and so many moving parts that it still continues to be an opportunity for all of us to continue educating our health centers and the public at large. And again, what's great about community clinics and health centers is we have a direct access to those who benefit the most from this Affordable Care Act. And so we just want to make sure that as things are being rolled out, the populations that are going to be served are truly considered in the legislation at the state level, and also as it continues to be rolled out at the federal level. So for that, I just wanted to highlight our Healthcare Ambassador Program. We did a lot of train-the-train model, but as we continue, we realize that there's other components like advocacy and policy that is going to be impacting how the ACA is implemented here in California. And so we want to be able to provide a space for our advocates to be familiar with what's happening and be able to ask the questions and provide both to our level, our staff level community, as well as our patients on some of the transformations that are happening at the state and federal level, and be able to have them relay the message back to their communities. So for this, we're doing, we continue doing our education campaign, ever evolving materials, working with our partners to make sure that accurate information gets out to the community via fact sheets and all of that, but also to educate our legislators about health centers, the impact of the ACA to them, and being able to build that relationship with them. For example, having a key contacts, as we got new legislators this year, we wanted to make sure that they recognize health as an important priority to our communities, and so making sure that they built those relationships there. And I just wanted to share some of the materials that we've developed besides some of our fact sheets on, what does the ACA mean for children and families, seniors, and also for the individual. We created these pocket guides for our clinicians to be able to ask some of the broader big FAQ questions, but most certainly providing an update on our website as questions came out. Most of our materials are in 5 different languages, but we certainly recognize that, we have to continue to provide updated information as things change. The other piece I wanted to speak to is our California Health Plus campaign. We've been working on this for 2 years, and we've just actually launched in partnership with TCE some of the media strategy around getting the broader public to get familiar with California Health Plus. It's an innovative new vision and brand to actually educate our patients about the benefits of community clinics and health centers. As I mentioned, community clinics and health centers are across the state, but a lot of people may, there may be some stigma around it, or might not be familiar with them. And so our goal with this campaign is to make sure to let people know what CCHCs offer. And what's great about it is that they're culturally sensitive, and one of our larger campaigns that we're working on is that they're patient-centered, focusing on a broader holistic approach to health, which I think is great when we think about people's health moving forward. As mentioned, prevention, one of the pieces, mental health, dental, and all of these other areas of health. And so I just wanted to provide some of the resources. I did have linked on here, and we can have LULAC provide that to you all. Some of the sites and resources that are really helpful. Our California Health Plus site mentions some information about our community clinics specifically. It's available in English and Spanish, and we also have a toll-free line where people can call and find out about a health center that's nearest to them. So it's available in English and Spanish. So if people call, they will get information about what is happening and where they can go to find out information about a community clinic health center or how to enroll. So that's a great opportunity for people. Covered California, the marketplace here in California that also provides some good information on what's to come. As mentioned, Asegúrate, we are working in partnership with the endowment to direct people to our health center sites for more information on being able to enroll. In addition, we're part of Latino Health Alliance with the National Council of La Raza, California Immigrant Policy Center, Californians Latinos for Reproductive Justice, MALDEF, and COFEM. And again, our focus is to, LCHC is one of our partners, and definitely focusing on Latinos health here in California. I'm looking forward to additional partnerships with LULAC. We've been building that up in this last year, and so there's definitely opportunity for growth and a lot of opportunities moving forward. So I just wanted to give you a brief overview of some of the things we're working on and trying to get out to the community about what's changing and hopefully not confusing people. But I most certainly want to provide you my information. If anybody has questions or would like to get involved in any way, our activities are all free. We host monthly webinars on special topics. In particular, we have one on September 18th, which will focus on special populations, including Latinos, and the Affordable Care Act. So that's an opportunity. If anybody's interested in joining, you can contact me via email or phone, and I can provide you that additional information.
Wonderful. Araceli, thank you so much for joining us. I just sit here and I look back, and how wonderful it is that we can get all these organizations together with different areas of expertise and share it all at once. So thank you so very much for your comments. Once again, here's her contact information. And if you're not able, once again, to write it all down, please feel free to call the LULAC National Office at 877-LULAC-01 or to visit our website at www.lulac.org. I also see we have quite a number of questions coming through, and just for the folks who turned in a little bit late, we're going to be answering all the questions at the end so we make sure all the presenters have a chance to go through their entire presentations. So our next guest speaker is Melinda Kelly, who is here from the National Institutes of Health to talk a little bit about what they're doing in this area and our partnership. So welcome, Melinda. How are you doing this evening?
I'm doing great.
Wonderful. Thank you for joining us and taking time out to join this important webinar.
Yeah, we really appreciate the opportunity to be here tonight. So my name is Melinda Kelly, and I'm a program manager for a program called We Can, which stands for Ways to Enhance Children's Activity and Nutrition. And it comes from the National Institutes of Health, and we're on the East Coast in Bethesda, Maryland. And our name in Spanish is Podemos, so you'll see them used sort of interchangeably in the presentation. And I should mention that although I'm from the National Heart, Lung, and Blood Institute at the NIH, the program is a collaboration across the 3 additional institutes that you see listed on the slide. So it truly is a joint effort. Let me see if I can advance the slides.
That's me. Let me go ahead and give it to you. There you go. You should have control now.
Okay. Okay, great. So what is We Can, or Podemos? We're a national education program that targets youth as well as their parents and caregivers at home as well as in community settings, and the goal is actually to help all kids lead healthier lives. So sometimes we're interpreted to be a weight loss program. We're not a weight loss program. We really want all kids, whether they're overweight, obese, or at a normal weight, to be eating healthfully, moving more, and reducing their screen time. So what we do is we take the science that's funded by the NIH and as well as other scientific studies, and we have brought them together to form a number of different curricula for both parents and youth. We have a lot of other resources that go along with those curricula, and we offer technical assistance for community organizations who are implementing these curricula at the local level, as well as national and regional partner organizations. And we have a lot of relationships that we've established, and those are sort of tailored depending on what the partner is interested in doing with our programming. We try to be really flexible to fit diverse needs, because we know that even though we're sort of bringing the science to the table, all communities are different, and we can't possibly predict what are going to be specific barriers in one community versus another. So we really count on the community organizations to be able to look at the barriers in their community and the needs, and to take our materials and our resources and our curricula and deliver them in a way that is the best fit for that particular community. So I'm just going to talk about one of our programs tonight, our Energize Our Family Parent Program. We have several youth curricula that I won't mention, but if you have questions about those, feel free to contact us. The Parent Program is a 4-session curriculum designed for parents and caregivers and really any extended family members who are interested in these topics. And it focuses on sort of those key 3 behavior change themes of eating right, moving more, and reducing screen time. And so we cover a wide range of topics in the program, including energy balance, physical activity, helping families deal with busy lifestyles, reading nutrition facts labels, just a range of topics. We have a lot of supplemental materials that you can combine with the program if you want to, but you don't have to. And we also have the facilitator's guide you see there, our leader's guide, has a lot of information on recruitment, retention, really how to get your programming going. We also have a family guide, which is a separate document that's downloadable from our website, and that contains all the handouts for the program. In the past, we've had a lot of printed copies. We do have some remaining copies, but we're sort of moving toward downloadable materials where possible. We also have both an online training program that's currently available that walks you through the Leader's Guide, but we also have webinar trainings that we're doing through a collaboration with Let's Move Faith and Communities. And I don't really have space in this presentation to list all of the upcoming dates, but we do have trainings for the parent program as well as one of our youth curricula called Media Smart Youth coming up. The next one is next week, so if you're interested, I would urge you to go to this link. This is the Partnership Center at HHS website, and you'll see all the dates, and you'll see the links to sign up for the individual webinars there. Okay, so I just want to mention a couple of the concepts that we have in our program. The Go Slow Whoa Foods is kind of a fun traffic light conceptual framework for thinking about foods ranging from the best foods to be eating, most often the go foods, those are the lowest in fat, sugar, and calories, all the way up to the what we call the woe foods. Those are the ones that are more like treats. You want to have those once in a while or in small portions. The reason I wanted to mention this is one of the concepts that we have translated or adapted for our Spanish-speaking audiences. You can see there the You Are What You Eat handout. We actually have one in English, but this handout was adapted by one of our community organizations. So we've had a lot of our community sites who really dug into our materials and helped us with some of these adaptations, especially some of the more difficult concepts that don't translate directly. You see the image down in the bottom right. That is a more recent update that we've had. One of our staff members in our offices helped us with some of the Spanish translations. So we're constantly trying to keep these materials fresh and keep the concepts understandable so that we're not losing something in the translation. And we always want to start with a positive, no matter what audience we're talking to. And one of the things that we like to point out is for Latino audiences is that many traditional Latin foods, and this is true of other cultures as well, are actually go foods. And so we want to sort of start with the positive messaging and not just focus on things that people shouldn't be doing. And this slide actually gives me a chance to point out that one of the things that we have that is always a hit with our community organizations is our recipes. We have a lot of recipes, many traditional Latino, Hispanic recipes that we've done healthy makeovers of, and we have a bilingual cookbook, which you can see there. And we've also recently done some really nice recipe photography and have a whole series of recipe cards that are now available from our website that, again, present these traditional recipes in a sort of healthy makeover version. In addition to the recipes, we have a lot of other resources that you might find useful if you choose to run our programming or if you know of others who would want to do our programming. We have a pretty extensive website now in Spanish. It's not a complete mirror website, but we have done a lot of work in the last year or so translating all of our key information pages on the left-hand side, as well as we have a lot of our tip sheets and other information that's available for download from this page. And you'll see the Espanol link when you go on the main weekend website, and the link for the Espanol site is at the bottom as well. You'll see on the right-hand side, that is our parent handbook in Spanish, and we have that downloadable. And then we have a number of other resources. On the next page, we have, whoops, there's a little bit of a lag. We have a number of our parent tip sheets in Spanish. We have community news articles. And more recently, we've been able to work with the Health and Human Services Public Affairs Office to do a pretty large media outreach campaign. And one of the audiences that we were able to provide some targeted information to were Spanish-speaking audiences. And we have both the print ads, like the ones you see there, but we also have television and radio PSAs that are available. And you could get copies of those from us and repurpose them if you have somewhere that you'd like to utilize them. Now, I just want to mention a couple of examples of how we're working in communities. The first example is at an academic research center in California, and this is the work of Dr. Kathy James at the University of San Diego. And Dr. James was actually planning to speak tonight, but she had a family emergency and unfortunately wasn't able to come. But I just wanted to mention that she has actually used our We Can Parent program as an intervention with Latina mothers to try and change health behaviors. She used a 6-week version of our program. We used to have a 6-week version that was we was using our piloting of the weekend program, but we found that it was a little bit hard to get parents to come to 6 sessions. So we've also offered the 4-week session that I mentioned before. But she involved 35 Hispanic mothers, recruited from an elementary school. She used both our evaluation tool that we make available for the program, but she also collected height, weight, and BMI data. And that's not an obligation of community organizations who run the program, but it's always nice when groups do this so that we can, just make sure that, the trajectories that we're seeing are at least in a positive direction. And she found across a number of measures, across knowledge, attitudes, and behavior change, significant improvements. So this was just a pilot. It was a small group, but it was encouraging to us when you actually put this into a research setting and you use it as an intervention that you see a positive outcome. And the other example I'd like to share is actually an East Coast example, and this is Unity Healthcare. This is a large group of clinics that is located in Washington, D.C. They have a large Spanish-speaking population, low health literacy, and they have been a terrific community site for us, working in terms of implementing our parent program for a number of years, and they've included a lot of different community partners who help them with their programming. And they've also done some evaluation, again, looking at weight loss. Weight loss is not necessarily a goal for the program, but they do want to look at the BMIs to make sure they're moving in the positive direction. But they also look at health knowledge and have found some positive outcomes. And they've actually expanded their programming to, I think, a total of 7 sites in our region. So that's been a very exciting group that has really been able to take a lot of our materials and adapt them for their Spanish-speaking audiences. So that's all I want to mention tonight. We have a lot more information that I didn't have time to cover. I would encourage you, if you have any questions or if you think there's material that you could use or you're interested in implementing our programming, please get in touch with us. You have my email address there, as well as my colleague Melissa McGowan. So thank you again so much for the opportunity to speak tonight, and I look forward to hopefully talking with some of you in the future.
Thank you so much for presenting that, Melinda. And I think I'm going to hit the website and pull down that cookbook as well. It's terrific. So thank you once again, and remember everyone, juntos y podemos. So our next speaker is Ms. Anna Hoff, the Outreach Coordinator for Text for Baby. And I'm going to go ahead and give you control right now, Anna. And let me just say once again, too, thank you so much for joining us this evening.
Thank you. It looks like oh, there we go. It looks like okay, kind of have control.
Yeah, there's a little bit of a lag in there, so.
Oh, okay, here we go. Sorry about that.
Not an issue.
A little bit. So I'll just go ahead and get started a little about Text for Baby by first describing why we chose mobile health. And so the way that Text for Baby works, of course, is using text messages to provide health information to moms and new parents. And to date, as you can see from these stats, nearly 89% of young women actually own cell phones, And what we're finding is that 99% of text messages are read, 90% within the first 3 minutes. And when we look at texting, we are finding that our efforts in reaching out to Latinos are particularly helpful for us because disproportionately we're noticing that Latinos and individuals and groups of color are more likely to text than any other group. Text for Baby is a free service. It comes from a nonprofit, National Healthy Mothers, Healthy Babies Coalition, and our founding sponsor has been Johnson & Johnson. We currently to date have had over 600,000 women nationwide enrolled, 53,000 of which were in California. Text for Baby is available in English and Spanish and provides customized messages to moms and babies, and I'll show you a little example of that later on in the deck. The way that Text for Baby is completely free comes from all of these various wireless, mobile wireless carriers who have actually signed a contract to provide this really important service as a public utility for the entire nation. So regardless of mom's texting service, unlimited, limited, you name it, it's a completely free service. It doesn't touch her capability to use her text messages or not, and that includes any surveys that we conduct through the service. The way that Text for Baby works is mom texts baby or bebé for Spanish to 511-411, and the system will then prompt her for her due date or her child's date of birth, since the messages go up until baby's first year, and her zip code. And again, these are completely free messages that are sent to mom, and because she's putting in her due date or her child's birth date, all of these messages are tailored. So she'll be receiving those 3 text messages a week, and they'll be tailored to her trimester or to her child's developmental stage. We cover an entire range of critical issues from smoking cessation to types of nutritional importance during pregnancy, and also incorporating really practical steps on how to introduce food to your child, safe sleep, exercise, you name it. And within all of these messages, around 2/3 of them actually contain resources and services specific to the content within that message. So moms and dad can actually reach out to additional resources and services if they need low-cost immunizations or additional food support, you name it. So going back to that first slide where I said that 99% of text messages are read and 90% within the first 3 minutes, because we have this really timely interaction with our moms and all of our Text for Baby participants, we are able to send out urgent health recalls, outbreaks, natural disaster messages, and you can actually see the full range from Hurricane Sandy to hot cars, safe sleep, you name it. Text for Baby as a service has a lot of new additions. So those of you who have actually already heard of the service, it's changed quite a bit in the last 3 years. So now what moms are actually able to do, and dads, is they can text remind or cita in Spanish, and the system will then prompt them to start providing appointment reminders. And what we're noticing with this is that moms and parents who don't have smartphones are able to use Text for Baby as if they have a smartphone and really get that additional reminder that helps with appointment adherence and retention. Every flu season, we send out a message to moms and dads asking them if they're planning on getting a flu shot and providing them with a series of answers. Based off those answers, we send tailored responses. So if they reply yes, we ask them if they'd like to set a reminder. And then in many cases they will, in other cases they won't. If they reply no, we ask them for an additional question as why not. From those various answers, I think it might be the flu, the cost, I don't think it's safe, we provide additional resources. So if it's cost, we'll provide low-cost immunization resource or a myth-busting resource around immunizations. What we found from this is that 14% of those who said initially that they were not planning on getting a flu shot subsequently reported getting it. Another question that we ask early on is asking moms and dads whether or not they have health insurance and what type. And you can see on the slide, based off of this, it's set up the same way as the flu module, where based off their answer, we provide additional information. So if they tell us they're Medicaid or CHIP or do not have health insurance, then we provide them with additional information. And what we found with our preliminary results from this, and this is an ongoing project, so we always have a much greater sample size, is that 13% of those who said they did not have health insurance, over 50% actually went and obtained Medicaid or CHIP or some type of health insurance. For the state of California, we, of course, are a very special state, and we partnered with the California Department of Public Health to develop an immunization module that's focused on encouraging timely well baby visits at 2, 4, 6, and 12 months and encouraging vaccination. So this will start right before mom gives birth and carries on up until the first year of baby's, till baby's first birthday. And our sample size for this, so we actually have some preliminary results from what we've done thus far, and 85% of which came from California. So Nevada is also another state that has this module. And what we found from this is particularly interesting. So the state asked us specifically to find out additional information about hepatitis B at birth. And what we found is that 81% of our Tex-Rabe users in California who responded to this module said that they did, that baby did receive their hepatitis B vaccination at birth. And as you can see, that's much higher than our national averages. So what we are noticing is that our Tex-Rabe moms, particularly the ones who are providing self-report data, are more engaged and more active and able to go and get those immunizations. Similarly, within the immunization module, we asked mom if she would like to set appointment reminders, and what we found from that is that moms are very pleased to have this interactivity with the service, and 72% said that it was very helpful in actually getting them to remember these services. Additionally, more so for the Spanish-speaking population. So the way the Tex-Rabe is showing impact is a number of mechanisms outside of just what it is that we're able to survey with the specific modules. So UC San Diego and the National Latino Research Center at Cal State San Marcos conducted an evaluation that covered 625 of their sample size and found that 65% of users said that Tex-Rabe helped them remember an appointment or an immunization, and this is actually before we had the reminder module in place. 74% said that Tex-Rabe actually informed them of medical warning signs. 67% are now talking to their doctors about topics that they read on a Tex-Rabe message, so it's really facilitating that communication with their doctors. And 40% are reaching out and actually calling a service or a phone number that they're receiving from a Tex-Rabe message. And it's a higher percentage with those who do not have health insurance. So it's really improving that direct access to health services. Additionally, 94% of the participants enrolled in the Spanish-speaking service so that the messages are clear and understandable. And they also conducted some other questions to really determine the cultural and linguistic appropriateness of the messages and the service. When they took a look at the ethnicity of survey participants, they found that although across the nation we only have around 7% who are enrolled in the Spanish-speaking module, over 50% of which are reporting that they are Latino or Hispanic. Again, this is just for San Diego. So Daryl, could you, oh, there we go. George Washington University also conducted an evaluation that showed that with a randomized controlled trial that Tex-Rabe moms were 3 times more likely to believe that they are prepared to be new mothers compared to those in the control group. They also noticed significant improvement in attitudinal shifts, looking at fruit and vegetable consumption, taking prenatal vitamins, understanding the effects of smoking, and the importance of visiting a healthcare provider. I'm going to cut things short, and I want to welcome anyone on the phone if you're interested in taking part in this initiative and really helping to get some outreach in your community to please join and click on the link below. Become a partner. It's completely free, no cost to your organization. We even provide outreach materials and additional resources if needed, webinars, staff trainings, and my contact information is available below.
Wonderful, Anna. That was just terrific. You know, everybody brought something so wonderful to this evening's webinar. And I can think of a few people that I'm going to be recommending this to actually right away. So thank you so much for joining us this evening. Everyone, really, as I said, I thought the content, the presenters, everything was just excellent. So I want to thank you all for joining us this evening. I know there's been a number of questions that came in, so I'm going to go ahead and read these here, and hopefully we can discern which presenter they are targeted for, and we can get those asked. So let me go ahead and open this up. Okay. Well, there was a question here, will Obamacare cover preventive care? And I do believe the answer was yes to that. I heard during the presentation, correct? I'll ask one of our panelists to respond.
This is Javier. Yes, correct. It's one of the 10 essential benefits that one would receive under any of the plans that are being offered through Obamacare.
And our next question here, and I think it goes to the slide of where life expectancy was different depending on where you live. And this question is, when you say environment, are you really saying lifestyle or what they are eating or where they live?
We're saying the environment where people live. Was one of the goals of the presentation, which could make it, if I had a longer time, is that the environment shapes our behavior. Especially for children. So, for example, if you if you live in a food desert, and let's say that it's a pretty high, there's high violence in this area, that the choices that one has to access healthy foods goes way down compared to a community that's higher income, doesn't have very much violence, and has, like a farmer's market and, a plethora of grocery stores. It's easier to access those things that keep one healthy. So when we talk about how environment shapes personal behavior and personal choices.
Well, wonderful. And our next question is, and it's regarding, once again, the Affordable Health Care Act. What does access for all mean? Who's included and who isn't? And what will it pay for? And there's a reference to traditional Western type medicine, or will it also allow for herbalists or osteopath or some other holistic type approaches? So who
this is Javier Morales again, but I don't want to answer everything.
Yeah. Is there somebody else? Why don't you go ahead and take it, Javier?
Okay, can you remind me what okay, so who does it cover? It covers everyone who's legally present in the United States. It does not cover undocumented populations, and it doesn't cover people who are in prison or incarcerated. This is California. And basically, if you file an income tax return and you are eligible for Covered California, if you make less than 139% of the federal poverty limit, you are put into something we call here in California Medi-Cal. That if you make between 139% and 400% of the federal poverty limit, you are eligible for the exchange and to purchase insurance through the exchange. If you make between 139% and 250% of the federal poverty limit, you're eligible for subsidies that could reduce your premiums and also reduce your co-pays, out-of-pocket costs as well. So other states, if you're interested in this, or if you're from California and you want to know exactly if you're eligible or not, you can go to the Covered California website. It's www.coveredca.com, and they actually have calculators on there that you could look at. Now, with regard to if it does provide for free preventative care, but with regard to the question on if it helps to pay for herbal approaches or alternative approaches, I'm not sure about that.
Well, wonderful. Thank you for answering that. I do have another question here. Are you going to have workshops on this issue at the American Public Health Association meeting in Boston are any of the, organizations on the line planning on attending that event? And you may not be aware if you are, so I just thought I would read that out there in case somebody was aware.
This is Javier. We will be presenting. I will be presenting. I don't have all the information in front of me. I forget the date, but I will be part of a panel that will be talking about the uninsured, alternatives for the uninsured, how we can still get coverage for people who don't qualify for the exchanges.
Well, wonderful. So let me take this. We've reached that 7 o'clock mark here Central Time. So we've gone exactly 1 hour. And let me take this opportunity to thank once again our primary sponsor at Walmart for the great work that they do in supporting our community and LULAC, as well as all of our partners. Thank you very much for contributing. Once again, if you have any questions, if there's anything you think of that you would like to have answered, please feel free to contact us at LULAC at 877-LULAC-01, or if you were able to get some of our panelists' information, contact them directly as well. We will have a bunch of information with regards to our Feria that we're going to have out there in LA on the website. It's there right now. If you go to LULAC.org, and we'll have a lot of facts and access to programs at our landing page, which is LULAC.org/health. We have been recording this webinar as well, so we're going to have it up in the next several days on the LULAC website as well. So once again, everyone, on behalf of our LULAC National President, Margaret Moran, our Executive Director, Brent Wilkes, our National VP for the Far West, Mickey Luna, and our State Director, Benny Diaz, thank you very much for joining us. And I do want to give a special thank you to our staff that did a fabulous job in organizing all of this. Everyone from Elizabeth Garcia to Elises Gonzalez to Declan, jumping right on in. We really appreciate the fine work you do. So everyone, thank you once again. Have a wonderful evening, and God bless.
Thank you.